Hello, I'm Dr Louise Jenkins. I'm the Head of School for Nursing and Midwifery at Anglia Ruskin University, and I want to talk to you today about our Nurse Associate programme. So the Nursing Associate role is the newest role in the nursing family, and it's governed by the Nursing and Midwifery Council. You undertake it as a foundation degree, and which is done over 2 years, and it's designed to bridge the gap between a healthcare assistant, who is someone who doesn't have necessarily any experience or qualifications in healthcare, and a registered nurse. You can use this role as a progression step onto getting a registered nurse status. So we do have nursing associates who go on to do their full degree and to register as a nurse. But the nursing associate role is a general qualification. You don't work and specialise in one particular field. You work across all of the fields of nursing. So that's adult, child and mental health nursing. And the NMC developed this role and it became on the register and governed by the NMC in 2019. There are some differences between a nursing associate and a registered nurse. So the main differences are that nursing associates will monitor care, whereas registered nurses will evaluate and look into whether care is working in more depth. And while a nursing associate will work as part of a team, it would be the registered nurse who would lead and manage that team. If you're interested in coming onto a Nurse Associate course, we ask that you have a GCSE in both Maths and English at grade 4 and above. And we do prefer that you've done some level 3 study, so that could be as A-levels, BTECs or equivalent. As with all of our Nursing and Midwifery Council registered courses, it is a requirement that you do an interview. So we will ask you to come along and talk to one of our academics who will talk to you about why you want to come on the course and talk to you about your values and what's important when you're caring for people. The Nursing Associate course is a foundation degree, so you're taught at level 4 and 5, and it's 2 years long rather than 3 for the full registered nurse course. It's 50% theory and 50% clinical practice, and you will be having placements in both acute hospital settings and community settings so that you see a full variety of care. The course is usually 45 weeks per year, so you get 2 weeks holiday in the spring, you get 3 weeks in the summer, and you get 2 weeks at Christmas. It's a fairly new role, but nurse associates can work across the variety of settings, and you can see here some of the different settings that nurse associates can work in. One of the routes, so you can do a direct entry nurse associate course where you come to us directly, you would choose to come to us, but apprenticeships are quite a common route for nursing associates. If you're an apprentice, your course is sponsored by your employer, so they choose which course they want to send you and when they want to send you on the course, and they choose which university they want to work with. They will pay your fees, so you don't have any student loans if you're doing an apprenticeship. And you will be paid as an employee, you'll be paid as a healthcare assistant during an apprenticeship for a nursing associate course, and that means you're not eligible for any of the maintenance elements of student loans for you to support your learning, so you will have to survive on the wages that they pay you. If you're interested in apprenticeships, then you should look at your local hospital trusts, look for healthcare assistant opportunities, and you can talk to them about opportunities for apprenticeships. Some trusts also advertise apprenticeships directly, so it's worth keeping an eye out if this is something you're interested in. If you want to do a direct entry nurse associate course, then you are eligible for student loans in the same way as other students are. The fees for a nurse associate course for a foundation degree are slightly less, and they're usually around £7,500 a year, and you have 2 years of your course. There are some maintenance elements that you'll also be eligible for, but any maintenance elements will be judged on what your household income is, so usually how much your mum and dad earn, and you need to repay that, and you will only start to repay that student loan once you're earning over £25,000 a year. We know that all of the jobs in the nursing family are very much a job for life, and we know that just over 99% of our students went into the roles for which they've been trained last year. So it's a really fantastic opportunity. If you're interested in finding out more about what we've talked about today, you can go onto UCAS Explore and have a look. You can go onto the Nursing and Midwifery Council website and see what they say about nursing associates. And you can also go onto the Royal College of Nursing. It's also worth having a look at University Open Days. So at Anglia Ruskin University, we're running virtual open days this year. Come along and talk to the course team and see if this is the course for you.